We all want healthy teeth and shiny smiles, but we don't want to be shocked by the price of procedures. Now, one dentist has taken the guesswork out of your next dental visit, and he's here to show us how it's easy. Welcome to the show, Dr. Lan Allen from Aeris Family Dental. Doctor, thanks so much for joining me.
Good morning. Thank you for having me.
Pleasure to see you. So let's talk first and foremost what inspired you to make this online estimator, because I was playing around with it. It's actually very easy to use.
Thank you. Actually, a couple years ago, I had a patient come in, and he had had some extensive treatment down in Mexico, and then he was asking me to kind of take over the treatment. And through the course of the conversation, we found out that I was only a couple $100 different. And when I told him about that, he was kind of shocked and surprised, and he said, well, I just didn't know. And that made me realize that healthcare is the one thing that's different for the way that we shop. There's price transparency for everything that we shop for, except for our healthcare, so that's where this came about.
Well, and it's that price transparency, and we'll talk about this a little bit later too, that might prevent somebody from actually seeking out or getting the help that they need for their health. Speaking of the estimate, how accurate is it to what it's actually going to cost?
Sure, it's in line with industry standards. We had to kind of be a little bit general with averages and things, but we are working all the time to make it more accurate and adding more procedures and trying to make it as clean as possible.
Well, and like I said, I was playing around with it. I know we have a picture of it, actually a little live demo of how it actually works. We're going to get the guys to put it up here.
Sure.
And there it is. Sort of walk us through what we're seeing.
Okay, so a patient would go to the website, they'd select a procedure. He's going to, I think, select a crown.
Yeah, crown veneer, all ceramic.
Perfect. He's going to say he has insurance. He's going to go down to, like, say, MetLife, for example.
Yeah.
And just simply click Get My Estimate. It'll calculate the total fee, the estimated patient's portion, and then we have some payment options on there and also a link to just schedule an appointment.
Wow, look at how simple and specific that is. I mean, you don't have to log in, and most importantly, you don't have to leave private personal information, right?
You do not, yeah. When we'd first designed it, I'd had that just so that we could check up and make sure that our estimates were accurate, but we decided to take that off and give it as a gift to anybody in the public, whether they see me or see another dentist, just so they're aware of what's going on.
Yeah, amazing estimator. You saw how specific it got with the different types of procedures, ceramic, etc. Very often it's hard to find that information. I mean, you can Google all day long. You're not going to find specific numbers. And you were talking about your offices. There's 3 locations that make it easy for really anybody.
We do. We have 3 office locations, one here on the east side of Tucson, one in the Vail area, and also one in the Marana area.
And because it's not a big corporate entity, you guys are able to innovate with things like the cost estimator, right?
Yes, we're 100% dentist owned. All of the dentists are from here in town. We own all of the practices, and so because of that, we have the freedom to do. We don't have any influence from any corporations and out of state or anywhere, so it provides a lot of freedom.
Well, it adds a whole other meaning to the family part of Aeris Family Dental, right? It's really all just very personalized and very part of the family.
Very much so.
Yeah.
Very much so.
And so, talking about dentistry, there are some myths out there, and people often, again, don't go to the dentist because of these myths. So, want to name a couple for us that are out there that are common?
The first one I think about and I get asked about a lot is that when we say somebody might have a small cavity, for example, they'll say, well, I don't feel anything.
Yeah.
And I'd say that one of the biggest myths is that you don't have a problem unless you feel it. And that's the problem start, and the feeling comes much later when it's a much bigger procedure, a big deal. So.
Right, so if you catch it early on as a little cavity,
Exactly.
and the only way you can do that is going in and getting a checkup, getting a cleaning.
Getting preventative. Then that would probably lead to a second myth, is that they can't go to an office unless they have insurance. And just a single visit a year, just for preventative, a look and see would be half the price of most people's data plans on their phones each month.
Right.
Yeah.
I mean, people are more willing to pay for their phone than they are for their teeth, but it should be really the other way around. And you can actually feel comfortable doing that and feel safe doing it if you know the cost with this estimator, for example.
Exactly.
And so that leads us to the biggest obstacle with people getting their dental work. Again, it's probably just knowing the cost, right?
It is. There's that. There's the fee. Healthcare and dentistry included is expensive. But prioritizing. If people maybe know what those fees are, maybe they'll realize that they can prioritize that and maybe put it in front of something that they may otherwise have been competing for their dollars.
Right, price transparency in medicine. Who would have thought, right? I mean,
We're trying.
That's how it should be, and you guys are certainly making it easy. I'm going to point them again to that website. Very simple and easy to use, and if all the dentists are like you, man, maybe I'll be there next time. Thanks, Doctor.
They're better.
Okay, pleasure to meet you. Aeris Family Dental has 3 convenient locations here in Tucson. Be sure to visit TucsonTeeth.com. Even the website's easy to use that online treatment estimator. Stay where you are. We'll be right back.